Welcome to my YouTube channel, Elite Health Tips. What if I told you that thousands of people are suffering strokes, heart attacks, and silent artery damage even while their blood pressure numbers look perfect at every doctor visit? Imagine waking up every morning, taking your medication exactly as prescribed, watching your blood pressure monitor show normal readings, hearing your doctor say, "Everything looks under control," and then one day ending up in the emergency room anyway. That is happening more often than most people realize. And the reason is both simple and deeply unsettling. In many cases, the treatment is lowering the number, but it is not fixing the actual damage happening inside the blood vessels. Think about your car for a second. If the check engine light suddenly turns on, you could cut the wire connected to the warning light and make the dashboard look normal again. The light disappears. The warning is gone. But underneath the hood, the engine continues to break down. Every mile makes the damage worse. That is exactly how high blood pressure is often treated today. The warning signal improves, but the deeper problem inside the arteries keeps progressing quietly in the background. Now, this does not mean blood pressure medication is useless. Far from it. These medications save lives every day and help reduce immediate risk. But many people are never told that blood pressure itself is only part of the story. The real issue often lies in what is happening to the blood vessels over years and decades. And if those vessels continue to stiffen, inflame, and deteriorate, lowering the number alone may not fully protect the brain, kidneys, or heart. I'm Dr. Franklin, and after years in preventive cardiology, I started noticing something that bothered me deeply. Patients were doing everything right. They took their medications, they reduced sodium, they exercised, they attended every follow-up appointment, yet many of them still experienced declining cardiovascular health. The question that kept driving me was simple: why? The answer did not come from a quick office visit or a standard prescription guide. It came from digging into the research most patients never hear about. What I found was that three hidden mechanisms are quietly damaging blood vessels at the cellular level, even when blood pressure readings appear controlled. These mechanisms are rarely explained in routine appointments, yet they may determine whether your arteries stay flexible and healthy or become stiff and fragile over time. And today, we are going to walk through all three of them carefully. Because once you understand what is actually happening inside your arteries, you stop thinking about blood pressure as just a number on a screen. You begin to see it as a reflection of deeper biological processes that either protect your body or slowly break it down. Before we go further, I want you to picture an old garden hose left outside for years under the sun. Over time, it becomes dry, cracked, and stiff. Now imagine turning on the water. Even normal water pressure suddenly strains the hose. The weak areas begin to leak. The connections fail. The pressure becomes inconsistent. Was the problem really the water pressure, or was it the condition of the hose itself? That distinction changes everything when it comes to hypertension. Most treatments focus on reducing the pressure flowing through the hose, but the real issue is often the condition of the hose itself, your blood vessels, their flexibility, their elasticity, and their ability to absorb the force of every heartbeat without damage. As we age, three specific forces slowly destroy that flexibility. They work quietly, often without symptoms, until the damage becomes severe enough to show up as heart disease, stroke, kidney dysfunction, or memory decline. And the first mechanism starts with something almost nobody talks about during a standard blood pressure appointment: the hidden inner lining of your blood vessels. Inside every artery in your body is an incredibly delicate structure called the vascular endothelium. This thin inner lining is not just passive tissue. It is biologically active and absolutely essential for cardiovascular health. Think of it like the smooth inner wall of a healthy riverbank. When it is intact, blood flows smoothly and safely. But when it becomes damaged, the entire vascular system starts to change. And what happens next inside that lining may explain why so many people think their blood pressure is controlled, while the real damage continues silently underneath the surface. In the next part, we're going to open up that hidden world inside your arteries and uncover the first silent mechanism that standard blood pressure care often misses completely. Inside every blood vessel in your body, from the large arteries near your heart to the tiny vessels feeding your brain and kidneys, there is a microscopic layer that quietly controls far more of your health than most people realize. This layer is called the endothelium, and for many older adults, it may be the missing piece of the entire blood pressure puzzle. Most people imagine arteries as simple pipes carrying blood from one place to another, but that is not what they are. Your arteries are living, responsive tissue. They constantly sense pressure, adjust blood flow, release chemical signals, and protect the delicate organs they serve. And the endothelium is the command center helping coordinate all of that activity. Now picture a calm river lined with healthy vegetation along its banks. The roots stabilize the soil, the water flows evenly, the structure holds together under stress. That is similar to what a healthy endothelial layer does inside your arteries. It creates a smooth, protective surface that helps blood move safely while also communicating with the muscular walls of the vessel. One of the most important jobs of this lining is producing a tiny signaling molecule called nitric oxide. You do not need to memorize complex chemistry to understand why this matters. Nitric oxide acts like a relaxation signal for your arteries. When blood flow increases, the endothelium releases nitric oxide, telling the surrounding vessel walls to widen and soften. This allows blood to move smoothly while reducing strain on the cardiovascular system. When nitric oxide production is strong, arteries stay flexible. They absorb the force of each heartbeat instead of resisting it. They protect sensitive organs like the brain and kidneys from pressure damage. They remain adaptable instead of becoming stiff and fragile. But here is where the problem begins for millions of people as they age. That protective endothelial layer slowly starts breaking down, and once that happens, the entire vascular system changes. Three major forces drive this damage. The first is chronically elevated blood sugar. Now, this does not only apply to people diagnosed with diabetes. Many older adults experience repeated blood sugar spikes after meals without even knowing it. White bread, sugary drinks, pastries, processed snacks, and refined carbohydrates can push glucose levels far higher than most people realize. Over time, this triggers a process called glycation. Think of glycation like rust slowly forming on metal. Excess sugar attaches itself to proteins and tissues inside the blood vessels, gradually damaging the protective lining. The result is a weaker, inflamed endothelial surface that loses its ability to function properly. The second destructive force is chronic low-grade inflammation. This is not the obvious swelling you feel after an injury. This is silent inflammation constantly circulating through the bloodstream. Poor sleep, processed foods, obesity, stress, and metabolic dysfunction all contribute to it. Day after day, this inflammatory state acts like sandpaper scraping against the delicate inner walls of your arteries. Then comes the third force, oxidative stress. Free radicals generated from pollution, stress, smoking, poor diet, and even aging itself attack the endothelial cells continuously. Imagine oxygen slowly corroding exposed metal. That is essentially what oxidative stress does to your vascular system over time. Years of these three forces working together create a dangerous transformation inside the arteries. The endothelium loses its ability to produce enough nitric oxide. Blood vessels stop relaxing efficiently. They become tense, narrow, and stiff. At the same time, the damaged vessel walls become vulnerable to invasion by inflammatory particles, cholesterol, and calcium deposits. This is where plaque begins forming. This is where calcification develops. This is where healthy, flexible arteries slowly become hardened and fragile. And here is the uncomfortable truth most people are never clearly told. Standard blood pressure medications do not directly repair this endothelial damage. Medications can absolutely lower pressure readings and reduce immediate risk, but the deeper structural injury inside the arteries may continue progressing silently if the root causes are never addressed. That is why some individuals still experience strokes or cardiovascular decline despite controlled numbers. The monitor may look better while the vessel walls underneath continue aging and weakening, but the story does not end there, because once researchers started looking deeper into why arteries lose flexibility, they discovered another major factor hiding in plain sight, a mineral deficiency affecting millions of older adults without them ever realizing it. And what this missing mineral does to your blood vessels may completely change the way you think about hypertension, aging, stress, sleep, and even the medications many seniors take every single day. A few years ago, I met a patient named Robert. He was 68 years old, a retired engineer, extremely disciplined, the kind of person who kept detailed records of everything. He arrived at my office frustrated because despite taking his blood pressure medication faithfully for years, his readings were still hovering dangerously high. He was not careless with his health. In fact, he was doing almost everything doctors normally recommend. He exercised several times a week, ate a relatively clean diet, avoided excessive salt, and barely drank alcohol. When patients like Robert continue struggling despite doing everything right, most people assume the next step is simply stronger medication, but something about his case made me look deeper. I ordered a test that most routine checkups never include a red blood cell magnesium level. The result came back significantly low. Robert was shocked because he thought magnesium was just one of those supplements people take for sleep or muscle cramps. He had no idea that magnesium is one of the most important minerals involved in cardiovascular function and blood vessel relaxation. Here is why that matters so much. Your arteries are surrounded by layers of smooth muscle tissue. These muscle cells constantly tighten and relax to regulate blood flow and pressure. Magnesium acts like a natural biological brake for those muscles. It helps them relax when they are supposed to relax. Imagine trying to drive a car downhill with failing brakes. Even if you press carefully on the pedal, the system stays tense and unstable. That is what low magnesium does inside the vascular system. Without enough magnesium, the smooth muscle lining your arteries struggles to fully relax. The vessels remain tighter than they should be, and blood pressure gradually rises as a result. Now here is the alarming part. Research suggests that a huge percentage of adults are magnesium deficient, and the problem becomes even more common with aging. Many older adults are living for years with chronically low magnesium levels without ever being tested. And the reasons go far beyond diet alone. One major factor is medication use. Several of the most commonly prescribed drugs for older adults actively drain magnesium from the body. Diuretics, often prescribed for hypertension itself, increase magnesium loss through the kidneys. In other words, the very medication used to control blood pressure may also worsen one of the biological conditions contributing to it. Proton pump inhibitors, medications commonly used for acid reflux, reduce magnesium absorption over time. Millions of seniors take these drugs daily, often for years, without realizing they may be slowly depleting a mineral their arteries desperately need. Then there is chronic stress. Most people never connect stress to mineral depletion, but elevated cortisol levels increase magnesium excretion. Poor sleep does the same thing. So the combination of aging, medication, stress, and modern diet creates a perfect storm for magnesium deficiency. And the effects reach far beyond blood pressure alone. Low magnesium is associated with muscle cramps, fatigue, poor sleep quality, heart rhythm abnormalities, insulin resistance, and increased vascular stiffness. But because the deficiency develops gradually, many people simply assume these symptoms are normal aging. Robert began supplementing with magnesium glycinate, one of the most absorbable forms available. Within about 10 weeks, his blood pressure improved noticeably without changing anything else in his routine. It was not some dramatic overnight miracle. It was biology responding to a missing piece finally being restored. Now, magnesium alone is not a cure for hypertension, but understanding the mechanism changes everything. Instead of only treating pressure as a mechanical problem, you begin addressing the underlying cellular environment that determines how blood vessels function in the first place. And that brings us to the third hidden mechanism, one that many people underestimate even more than nutrition or minerals. Stress. Not just emotional stress in the casual sense, but chronic physiological stress constantly reshaping the chemistry of your cardiovascular system day after day. Because the truth is, loneliness, grief, anxiety, financial pressure, caregiving exhaustion, and years of unresolved emotional strain do not simply affect your mood. They physically change your arteries, your hormones, your inflammatory pathways, and your blood pressure itself. And once you understand what chronic stress is actually doing inside your body at the biological level, you will never look at hypertension the same way again. When most people hear the word stress, they think of something emotional, temporary, or secondary compared to physical illness. Even in medical offices, stress is often treated like a side note. Patients describe anxiety, grief, loneliness, or emotional exhaustion, and the response is usually brief. Try to relax. Then the conversation quickly returns to prescriptions and lab results. But chronic stress is not just an emotional experience. It is a measurable biological process that directly changes the cardiovascular system at the cellular level. And for many older adults, this hidden stress response may be silently driving blood pressure higher every single day. Here is how it works. Your brain is constantly scanning for threats. Some threats are obvious and immediate, like danger or injury. Others are quieter and ongoing: financial pressure, caregiving responsibilities, chronic illness, social isolation, fear of aging, or the loss of a loved one. The body reacts to all of these experiences using the same survival system. When the brain senses stress, it activates a pathway called the hypothalamic pituitary adrenal axis. That triggers the release of stress hormones, primarily cortisol and adrenaline. In the short term, this response is incredibly useful. Your heart beats faster, blood pressure rises, blood vessels tighten, energy is redirected toward survival. If you suddenly needed to escape danger, this system could save your life. The problem begins when the body never fully exits that stress state. For many older adults, the stress response becomes chronic. Instead of activating briefly and shutting off, it stays partially switched on for months or years. And when cortisol remains elevated for too long, it starts damaging the cardiovascular system in very specific ways. The first effect is reduced nitric oxide production. Remember nitric oxide from the earlier discussion about the endothelium? That molecule is essential for keeping blood vessels flexible and relaxed. Chronic cortisol exposure interferes with the enzymes responsible for producing nitric oxide. The result is tighter, narrower arteries that remain in a constant state of constriction. The second effect involves sodium retention. High cortisol activates pathways that tell the kidneys to hold on to sodium and water. More retained sodium means more fluid volume circulating through the body. More fluid means higher pressure inside already stressed blood vessels. This is why some people notice blood pressure spikes during periods of prolonged anxiety or emotional strain, even when their diet has not changed significantly. But perhaps the most overlooked effect of chronic stress is what it does to the structure of the arteries themselves. Long-term cortisol elevation increases inflammatory activity inside the vascular system. Over time, that inflammation damages the elastic fibers that allow arteries to stretch and absorb pressure normally. The vessels gradually stiffen, becoming less flexible and more fragile with age. In other words, chronic stress can literally make your arteries biologically older faster. Now, here is what makes this especially important for older adults. The stress driving these changes is often not dramatic or obvious. It is frequently quiet and persistent. It is the loneliness after retirement, the silence in the house after losing a spouse, the daily anxiety of managing medications, finances, and doctor appointments, the emotional burden of chronic pain or declining mobility, the fear of becoming dependent on others. These experiences are real biological stressors, and they leave fingerprints throughout the cardiovascular system. This is why two people with similar diets and similar medications can experience very different blood pressure patterns depending on their emotional and nervous system health. And the encouraging part is this: once you understand the mechanism, you can begin interrupting it. Because the nervous system is not fixed. Blood vessels respond to breathing patterns, sleep quality, social connection, inflammation levels, movement, and relaxation practices more than most people realize. Which brings us to the most practical part of this entire discussion. If these three hidden mechanisms are contributing to blood pressure problems, endothelial damage, magnesium depletion, and chronic stress activation, then what can actually be done about them? Not vague wellness advice, not trendy internet hacks. Real, practical, evidence-based steps that target the root biological problems underneath hypertension itself. In the next section, we are going to build a complete step-by-step protocol designed to support the blood vessels directly, improve nitric oxide production, restore mineral balance, calm the stress response, and help the cardiovascular system function the way it was designed to again. Now let's move into the part that matters most, what you can actually begin doing to support your blood vessels, instead of only chasing lower numbers on a monitor. And before we start, I want to make something very clear. None of these strategies are meant to replace prescribed medication on your own. If your doctor has you on blood pressure treatment, continue taking it exactly as directed while working on the deeper causes underneath the condition. Medication can reduce immediate risk and protect against dangerous spikes. What we are discussing here is the long-term repair and support of the vascular system itself. The first step is protecting the endothelial lining, that delicate inner surface of the arteries responsible for producing nitric oxide and maintaining flexibility. The biggest enemy of that lining is repeated blood sugar spikes. This does not mean you need an extreme diet or complicated nutrition plan. In fact, one of the most effective changes is surprisingly simple. Start paying attention to what happens after you eat. Meals built around refined carbohydrates and processed sugars can cause sharp glucose spikes that damage the endothelial surface over time. White bread, sugary cereals, pastries, sweetened drinks, heavily processed snacks, and large portions of refined starches are some of the biggest contributors. Instead of focusing on restriction alone, focus on slowing glucose absorption. Fiber-rich foods help tremendously here. Beans, lentils, vegetables, berries, nuts, seeds, and moderate portions of whole grains create a steadier blood sugar response that is much easier on the arteries. And one of the simplest interventions may also be one of the most powerful: a short walk after meals. Research consistently shows that even a 10-minute walk after eating can significantly reduce post-meal blood sugar spikes. This is not about burning calories. It is about using your muscles to absorb glucose before that sugar can damage blood vessels. The next priority is reducing chronic inflammation. Fatty fish like salmon, sardines, and mackerel provide omega-3 fatty acids that help calm inflammatory pathways directly linked to endothelial injury. Extra virgin olive oil contains compounds that support vascular health. Dark leafy greens provide both magnesium and powerful anti-inflammatory nutrients. And colorful fruits and vegetables are not optional additions for older adults, they are protective tools for the cardiovascular system. Blueberries, for example, contain compounds called anthocyanins that have repeatedly been associated with improved endothelial function. Dark chocolate with high cacao content also contains flavonoids that support nitric oxide production and vascular relaxation. Now let's talk about magnesium. If your body is deficient in magnesium, your arteries struggle to relax properly no matter how healthy the rest of your routine looks. And not all magnesium supplements work equally well. Magnesium glycinate and magnesium malate are among the most absorbable forms and tend to be gentler on digestion. Magnesium oxide, despite being common and inexpensive, is poorly absorbed by many people. For most adults, daily intake in the range of 300 to 400 milligrams of elemental magnesium is commonly used, often divided into morning and evening doses. The nighttime portion may also improve sleep quality, which indirectly supports blood pressure by reducing cortisol and nervous system activation. However, people with kidney disease should always speak with their physician before supplementing magnesium because the kidneys regulate magnesium balance in the body. The next major focus is rebuilding nitric oxide production. Remember, nitric oxide is one of the key molecules that keeps blood vessels flexible and responsive. Without it, arteries become stiff and resistant. One of the most effective natural ways to support nitric oxide production is through dietary nitrates. Beetroot, beet juice, arugula, spinach, celery, and pomegranate all provide compounds that the body can convert into nitric oxide. Studies have shown that regular beet juice intake can lower systolic blood pressure by several points, sometimes approaching the effects seen with certain medications. But here is the fascinating part many people never hear about. Your nose plays a major role in nitric oxide production too. Nasal breathing naturally increases nitric oxide levels far more effectively than mouth breathing. Even more surprisingly, humming amplifies nitric oxide production dramatically because of the vibration it creates inside the nasal passages. Something as simple as 5 minutes of slow nasal breathing, combined with gentle humming each morning, may help support vascular function in ways that sound almost too simple to matter, but the biology behind it is very real. And now we arrive at the final piece of the protocol, perhaps the most underestimated factor of all, directly calming the chronic stress response that keeps blood vessels locked in a constant state of tension. Because no matter how healthy your diet becomes, your arteries cannot fully relax if your nervous system never feels safe enough to let them.